So, today I'm going to show you how to give yourself a bowel detox. And when I say bowel detox, I basically mean empty your bowel um, and do that periodically, particularly if you suffer from IBS type symptoms. However, everybody is different and always get this checked with your family physician or doctor whether there's any problem doing this for you. I'm a gastroenterologist and I see patients on a daily basis. It's a very common situation when a patient open their bowel but they don't feel happy because they feel there's still something left inside. It's a form of constipation. Actually, they don't feel they are constipated because they are opening their bowels, because most people feel that constipation means actually you're not going, you want to go but you're not going. But that is not that common. The opposite is common, which is you go, I call through a yo-yo, meaning you are getting more and more constipated and then you started pouring out and then constipation and pouring out, or it may be pouring out and normal and pouring out and normal. So try this might work, and it's a very simple thing to do with almost no side effect. So it's Epsom salt, which is magnesium sulfate. It is a white crystals. Before, all the pharmaceutical companies came with many brand names of laxatives. This used to be in a household purchase and consumption. It's a laxative because when you take this with water, it's osmotic laxative, means it draws water inside your bowel and soak all the stool and increases the volume of the stool so that it expands the muscles and the lining of the bowel, and then the bowel contracts and you expel. So on the level it says that take up to 1 tablespoonful, but I suggest if you're a standard size adult you just take 2 tablespoonful, level, not hipped. Okay, but this is extremely yucky. It's like astringent, and normally I'm not a great fan of having juice or any kind of bottled juice, because this is very detrimental for your health if you do it regularly. But occasional is fine. We want to have diversity and different types of experience in life, so that's fine. But this is a situation when I strongly recommend that you mix it with something, maybe lime juice or a little bit of sugary soury things to mask the real awkward taste of it. And then you drink this, and then don't go out, because in the next 2 hours, up to sometime up to 6 hours, depends on how blocked up, how bunged up you are, you will have bowel evacuation, maybe 6 times, maybe 8 times. But it is normally not crampy or painful. So you just go, you just feel the urge, you go to the toilet, make sure you book the toilet, because if there's a family toilet and there is a competition, there can be utter consequences, you know what I mean. So towards the end your bowel motions will look like liquid water coming out. So if you're like above age 40 45 and you're suffering from a little bit of bowel slowing down, this is something that I suggest, try it out. I mean, it might work, it might not work. Try it out. First Sunday of every month, 6 o'clock, you wake up, you take it, and then you stay indoor. By lunchtime you're all empty. And this is a part one of the two-part strategy. And second part is about prebiotic and probiotic, like a cocktail that you should take every morning to change the bacterial composition of your gut, like a bacterial microbiome. You may have heard it. The better, the more variety of bacteria you get in your stool, the better is your bowel health. It should look like a tropical rainforest rather than Sahara desert. Millions and billions of different bugs living in harmony, each doing their own stuff, producing important chemicals like serotonin to keep you happy and all that stuff, and synthesizing some vitamins, and degrading the fibers. So drink this and then down another glass of plain water to just wash it down and stay indoor. You can have more water depending on how much water you lose during this, but it's not a great amount of water loss. And sometimes, you don't know, we see really old stool coming out. Remember, the old stool is more blackish brownish and the fresh stool is more greenish yellowish. You need to have a kind of between yellow to brown, not black, not green. That's the intention. Like, you can tell about the hydration of your body by looking at your urine color. If it's too yellow, that means you are dehydrated. If it's too light like water, you are not dehydrated, you are overhydrated. So similarly, I'm a gastroenterologist. I jokingly call myself a shit doctor because I can describe the stool in many different ways. The color, the consistency, is it like porridge, is it like cow pat, is it soft sausage, is it like rabbit poop? So this is my day-to-day life. I subspecialize in hepatology, but this is one of the fascinating thing about human body, the gut health. And there's many things that you can do to improve your gut health without resorting to pharmaceutical products, and alleviates a lot of the suffering. Unfortunately, every week, every day, I see patients coming to A&E with abdominal pain, with feeling sick, and maybe even passing blood from the back passage. And the main problem is, just take this, decompress your bowel, because bowel is like a long hose pipe, garden hose, and there are many kinks. It's one kink on near the gallbladder area called hepatic flexure area, and then there may be another kink as you go to the left side of your under the rib cage called splenic flexure, and then there's another kink in the pelvis called pelvic colon. So there's like a going up ascending colon, then transverse colon, then descending colon, then a loop like a sigmoid colon, and then the rectum. So majority of the problem is in the sigmoid colon, and that's where we see all the battles, all the diverticulosis, like pockets, because high pressure, you have read Pascal's law, the high pressure will get transmitted and all the weak areas in the bowel will balloon out, like pouch out, called diverticulosis. And that can get infected because it's a very powerful broth of like a culture medium with lots of bacteria, some bad and mostly good. So if you iron out the kink periodically by giving something like this, you tend to have a better flow. The more stagnation means more bacterial fermentation, depending on the kind of food you are eating, and then the gas will raise up and you will feel like a band-like sensation on just under your rib cage, if you're female, like under the bra line. And unfortunately, most of my colleague doctors, they think, oh, it's dyspepsia, so it's either gallbladder problem or it's a gastric ulcer. And they are sent for an endoscopy, and almost 99% there's nothing on the endoscopy because the problem was never on the top and the problem is always on the bottom end. So by all means, do the safety check. If you think that you should do a gastroscopy, do it. I just do an ultrasound scan, make sure that all the organs are fine, the gallbladder is fine, and then I try the simple stuff rather than giving everybody a colonoscopy. Sorry, my alarm going off. You just flush your bowel. I don't suffer from any bowel trouble, but this is something that I do. I'm 53 plus, so I do every month, first Sunday of every month, just flush your bowel. It's a simple price to pay. Now, is there any risk in it? So basically, you don't do it if you're acutely blocked up, like a surgical abdomen, like a perforation, but that's what, like 0.001%. Yeah, and that will make you so unwell that you have to rush to A&E. But we're not talking about that. We're talking about IBS type of symptoms. Yeah. And the other thing is that although it's just one-off, once a month, I doubt there's any contraindication to this. But obviously, if you are on dialysis, a severe kidney problem, then this can accumulate in your blood. But that too, if you take it regularly, because some of my patients would rather not have it one big explosion, they would have a trickle, and that becomes more problematic if you have got kidney issues. But even with the kidney issues, if it's just one off, I doubt. But take your do your due diligence. But majority, just do it and see how you go. And if you suffer terribly the first time you take it, that proves probably, I think, that you have got a bunged up stomach. Because if you are blocked up in the bowel and you take this and it is trying to force it open and it can't because the door is locked too tight, that is more reason for you to do it maybe next Sunday rather than wait for 1 month. So sometime I tell that do it on every Sunday for the first month, then come second month, do it alternate Sunday, come third month, maybe just one Sunday. Yeah. So that's it. I'm going to drink it now, and I'll tell you the number of times I'm going to the toilet. You don't have to hear that, but just everybody's different. You may go to 8 times toilet. I may go to only 4 times because I'm already kind of pretty empty and my bowel, I don't suffer from any issues. But try it out. It's a small price to pay. Enjoy your day.